This segment is sponsored in part by the American Heart Association.
Someone in the United States has a stroke every 40 seconds, making it the leading cause of death and the #1 cause of disability. That is according to the Centers for Disease Control. Do you know the daily lifestyle changes that you could be making right now to prevent a stroke? May is National Stroke Awareness Month, and joining us this morning to help you and me and everyone else achieve a healthier and longer life are Michele Gervat from the American Heart Association and Dr. Rosaanabela Tavares, the medical director of Oak Street Health. Welcome. Thank you so much for joining us.
Thank you for having us.
Dr. Tavares, I'd like to start with you because heart disease is the #1 killer of Americans, and I think most people equate heart disease with heart attack, but that's not necessarily true. So can you talk about a stroke? What is it? What causes it, and what effects does a stroke have on the human body?
And that's such an important question, and this is such an important topic, and I really want to thank American Heart Association and you for having us here. So as you said, 1 in 3 deaths in the U.S. is from cardiovascular disease, but the good news is 80% of strokes are preventable. Stroke is just when your brain doesn't get enough blood flow and oxygen supply. Then your brain cells can die or they can get temporarily injured. Usually that happens because you have a blood clot or a plaque that blocks blood flow, usually what we call ischemic stroke, or a weakened blood vessel that burst. You could suspect you're having a stroke if all of a sudden you or a loved one has sudden loss of movement in a limb, facial droop, or slurred speech. Some others have more subtle changes like sudden changes in vision or balance, or severe confusion or headache. If you have any of these kinds of symptoms, you need to call 911 and get to medical care as soon as possible to prevent death or long-term disability from stroke.
These are such important factors because we're certainly not trying to raise the alarm, but raise awareness, because I know friends who've been in their 30s who have had those symptoms, and we have said, go. And it turned out that they were having a stroke. So Michele, I turn to you. The American Heart Association is bringing awareness about stroke awareness to folks in Long Island. So tell us about how you're partnering with the community to raise awareness in some very unique ways.
Thank you again for having us. COVID showed us the need. With keeping in mind the American Heart Association's 2024 impact goal is that every person deserves the opportunity for a full, healthy life. We saw the need to collaborate with organizations that were within communities, libraries. We work with Healthy Library Program out in Suffolk County with Stony Brook University and the Suffolk County Library System. We provide them with blood pressure cuffs as loaner programs, educational materials, hands-on education. It's with people bringing the education to people,
right,
with trust.
Right. Well, I was just going to say, bringing it to the community instead of waiting until something happens and then running to the doctor.
Absolutely, and having that awareness, because people during COVID were afraid to go to the doctor.
Right.
They didn't want to go. And so this was an opportunity for us to see what a great place to go. Libraries, people went there. And we saw that during that time, libraries did provide a lot of educational material, even if it was over video. It was incredible.
Right. Dr. Tavares, you know, high blood pressure is often referred to as the silent killer. And when we talk about making blood pressure monitoring more accessible, I know even when I'm in my doctor's office and they say 92 over whatever, I'm like, is that good? Is that bad? Am I healthy? Am I not healthy? So when folks are taking their blood pressure, and I know they're trying to make that more accessible in the community, what should they be looking for, and what should be causing concern?
So I would say that one of the most frequent questions I get from patients every day is, why do I need to make lifestyle changes or take medications every day? Because I feel fine. And many people can have dangerous levels of high blood pressure, diabetes, and cholesterol without any symptoms or very few symptoms. And the thing people need to understand is all of these conditions cause small changes in your blood vessels throughout your body over time, and they can lead to major complications like loss of vision, kidney failure, heart attack, and stroke. As you said, it's really important to know 4 key numbers. I always discuss this with my patients. That helps to predict your risk for these kinds of things. For diabetes, it's hemoglobin A1C. cholesterol, LDL, weight, BMI, body mass index, and blood pressure. The goal is usually 130 over 80 or less than that. But there are specific goals based upon your age and medical condition. So usually what I suggest to people is speak to your medical provider and get an idea of what's normal for you. And if you're running higher than you think, talk with them about the changes you can make.
Dr. Tavares, what lifestyle changes should we be making today?
So one of the things that I always tell everybody is, well, medication is needed for some, and it is an important part of the control of conditions like diabetes and cholesterol. What's really important is that there are free and effective lifestyle changes that everyone can do. And these can really help control, prevent, and even cure these conditions. And all of the lifestyle changes I'll talk about really address all three: diabetes, blood pressure, and cholesterol. First, of course, if you smoke, you need to learn to work with your medical provider to quit. And then for everybody else, the main thing is check your weight. And we want everybody to maintain a healthy body weight, usually a BMI, body mass index, less than 26. Move. Aerobic exercise of any kind, whatever gets you sweating, your heart rate jumping, 30 minutes a day, but you can also split it up. 5 minutes a couple of times a day or 15 minutes twice a day. Eat healthy. Healthy foods, most of your meals. You want to do lean proteins, lots of fruits and vegetables every day, several times a day, and limit processed and fried foods. And finally, breathe. It's really important for us to de-stress and get enough sleep. I always say change is hard, and I always advise my patients to start small, but dream big.
I like that. And if viewers do want to find out ways to improve their health and prevent a stroke, what's the best place they can go?
www.heart.org. There's information there, and also www.healthierlongisland.org.
I love it. And breathe. That is the biggest
breathe,
takeaway.
absolutely.
And breathe and move your body.
And breathe. Prevention is the thing.
Thank you so much for being here and sharing some really important information. We appreciate the time.
Thank you very much.